If you are over 60 and you have been noticing something strange about your eyes lately, maybe there is a faint gray ring forming around the colored part of your eye, or a small yellowish patch has appeared near the corner of your eyelid, or your vision went dark for a few seconds and then came back like nothing happened. I need you to stop whatever you are doing right now and watch this video all the way through. Because what most people do not know, and what I am going to share with you in the next few minutes, is that your eyes are not just for seeing the world around you. They are a window. And right now, that window may be showing you something your heart is desperately trying to communicate. Something that, if you ignore it, could cost you years of your life. Here is the terrifying truth that most doctors do not take the time to explain. Heart disease can build for a decade before you feel a single symptom. No chest pain, no shortness of breath, no obvious warning. Just a slow, invisible narrowing happening inside your arteries every single day. And by the time most people find out their heart is in serious trouble, the damage has already been building for years, sometimes decades. But here is what gives me hope, and what I want you to hold on to as you watch this video. The body is not silent, it sends signals. And four of the most powerful signals your cardiovascular system sends when it is struggling show up not in a stress test, not in a cholesterol panel, but right there in the mirror, in your own eyes. Signals that most people over 60 dismiss as normal aging. Signals that most doctors, unless they are ophthalmologists or cardiologists working closely together, do not connect to the heart at all. My name is Dr. Lumiva, and I have spent years talking with patients who came to me confused, scared, and asking the same question. Doctor, why did nobody tell me sooner? Today, I am telling you sooner. Stay with me through all four signs, because sign number 3 is the one that shocks people the most, and sign number 4 is the one that almost everyone gets completely wrong. Before I give you the 4 signs, I need to give you 60 seconds of science, because I want you to understand the why behind everything we are going to discuss today. This is not about scaring you. This is about arming you with real knowledge. Your eyes contain something almost no other visible part of your body has, a direct, living view of your blood vessels. The retina at the back of your eye is lined with tiny arteries and veins, and it is the only place in the entire human body where a doctor can look directly at blood vessels without cutting the skin, without an ultrasound, without an MRI. Just a light and a lens. That matters enormously because your eyes and your heart share the exact same plumbing system. The blood vessels in your retina are structurally almost identical to the blood vessels feeding your heart. When your cardiovascular system begins to decline, whether from high cholesterol, high blood pressure, plaque buildup, or hardening of the arteries, those same processes are quietly happening in the tiny vessels of your eyes at the same time. Often, the eyes show it first. This is not folk medicine. This is a documented clinical principle used by ophthalmologists and cardiologists working together, sometimes called the eyes as a window to the heart. Studies published in journals of ophthalmology and cardiology have shown that certain visible eye changes are independently associated with a considerably higher risk of heart attack, stroke, and cardiovascular death, sometimes appearing years before a person's cholesterol panel or blood pressure reading raises any alarm. And yet most people sitting in their living rooms looking at their own eyes in the mirror have never heard any of this in their lives. That ends today. I want to tell you about Susan. Susan was 65 years old, a retired nurse from Michigan. She had spent 30 years working in hospitals, taking care of other people's hearts, and rarely thought about her own unless something forced her to. About a year and a half before she came to see a cardiologist, Susan started noticing small, soft, yellowish patches forming near the inner corners of her upper eyelids. She was not alarmed. They did not hurt. They did not itch. They just sat there, slowly growing a little larger over time. Her primary doctor glanced at them during a routine visit and told her they were likely just a harmless cosmetic issue related to aging skin, something many people get, nothing to worry about. She was told she could see a dermatologist to have them removed if they bothered her appearance. For a year and a half, Susan lived with those patches, occasionally covering them with concealer before family photos. And during that year and a half, her arteries were silently accumulating plaque. When she finally went in for a routine physical that included a lipid panel, her LDL cholesterol, the harmful kind, came back extremely elevated. Her doctor took one look at her eyelids and said, "How long have you had those yellow patches?" Susan said, "About a year and a half." The doctor said, "Those patches have been telling us about your cholesterol for a year and a half." What Susan had is called Xanthelasma, and it is warning sign number 1. Xanthelasma refers to soft, yellowish, slightly raised deposits that form on or around the eyelids, most commonly near the inner corner, closest to the nose. They are made of cholesterol that has deposited itself just beneath the thin skin of the eyelid, which happens to be some of the thinnest skin on the entire human body, making these deposits visible long before cholesterol buildup would ever be noticeable anywhere else. Here is what makes this different from an ordinary skin blemish or age spot. Ordinary skin changes have no connection to your internal chemistry. Xanthelasma is different. It is not a skin condition at all. It is a cholesterol condition that happens to be showing up on your skin. The mechanism, simplified, works like this. When LDL cholesterol circulates in your blood at high levels for a sustained period of time, it does not stay politely contained. It infiltrates tissue. Around the eyelids, where the skin is exceptionally thin and the blood supply is close to the surface, cholesterol particles can escape the bloodstream and accumulate in small deposits, forming the visible yellow patches. Researchers have found that a meaningful percentage of people with xanthelasma have underlying elevated cholesterol, and multiple large studies, including one widely cited study following thousands of participants in Denmark over decades, found that people with xanthelasma had a significantly higher long-term risk of heart attack and death from cardiovascular disease, independent of their cholesterol numbers alone. In other words, the presence of the patches themselves carried predictive weight, not just the blood test. What you should do if you recognize this sign: do not simply book a cosmetic removal appointment and consider the matter closed. Call your doctor and ask specifically for a full lipid panel, total cholesterol, LDL, HDL, and triglycerides. Tell your doctor you have noticed yellowish deposits near your eyelids and you want your cardiovascular risk formally evaluated. Use those exact words. You have the right to ask for that test. One more thing I need to say about this sign. People over 60 often assume that anything appearing on aging skin is simply part of getting older, harmless by default. I understand that instinct, but I want to push back on it gently. A new yellow deposit on your eyelid is not a routine part of aging. It deserves investigation. Susan waited 1.5 years. You do not have to. Warning sign number 2, a grayish-white ring forming around the colored part of your eye called the iris. Your eyes tell your doctor an enormous amount about what is happening inside your body, and this particular ring is one of the most overlooked signals in all of preventive cardiology. Let me explain what it actually looks like and why it happens. If you look closely in a mirror, or better yet, have someone else look closely at your eyes in good lighting, you may notice a thin ring, sometimes white, sometimes gray, sometimes with a faint blue tint, tracing the outer edge of your iris, right where the colored part meets the white part of your eye. It typically starts at the top and bottom of the iris and gradually extends around the full circle over months or years, sometimes leaving a small clear gap before completing the ring entirely. The science behind it traces back to the same source as xanthelasma. This ring is made of lipid deposits, cholesterol and related fats, that accumulate in the outer layer of the cornea, the clear dome covering the front of the eye. When these fats build up faithfully in that specific location over time, they scatter light differently than clear tissue, which is what creates the visible ring. Now here's the detail that changes everything about how seriously you should take this sign. In people over roughly 70, this ring is extremely common and is often written off by doctors as simply Arcus Senilis, a Latin term that essentially means old age arc, treated as an unremarkable and expected part of getting older, similar to gray hair. And for people in their 70s and 80s with no other risk factors, that reassurance is often reasonable. But when this exact same ring appears in someone under 60, or is noticed developing rapidly rather than gradually, the clinical meaning shifts dramatically. Multiple studies, including research published in international ophthalmology and cardiology journals, have found that Arcus appearing at a younger age is strongly associated with elevated cholesterol and a markedly increased risk of coronary artery disease, sometimes appearing as one of the earliest visible signs of a genetic cholesterol disorder called familial hypercholesterolemia, a condition that dramatically raises heart attack risk and often goes completely undiagnosed for decades. Let me tell you about Gerald. Gerald was 63 years old, a former mechanic from Arizona who had spent decades leaning over engines, and he assumed the pale ring his wife had pointed out around his eyes 8 months earlier was simply what happens to everyone eventually. He dismissed it the same way he dismissed most things about his own body, as background noise, not worth a doctor's appointment. His wife finally made the appointment herself, worried enough that she stopped asking and started acting. At that appointment, his doctor examined the ring, asked his age, and immediately ordered a full cardiac risk workup. His LDL cholesterol came back severely elevated, and further testing revealed early coronary artery calcification, the beginning stages of arterial plaque buildup that Gerald had absolutely no idea was there. He had no chest pain, no shortness of breath, nothing that would have sent him to a doctor on his own. His eyes had been the only signal, quietly present for months, waiting for someone to take it seriously. If someone who loves you has commented that you have a strange ring or discoloration forming around your eyes, please do not brush it off, especially if you are under 70. The people who see us every day often notice changes that we ourselves stop seeing because we look in the mirror every morning and adjust gradually to slow shifts. Trust the observations of the people around you. Before we get to signs 3 and 4, and I promise you, these are the two that are going to surprise you most, I want to ask you something. If this video has already shown you something you did not know, if you have learned something that feels important and true, please tap the like button right now. I mean that sincerely. Not because I need the numbers, but because when you press that button, YouTube shows this video to other men and women over 60 who are experiencing these exact symptoms right now and do not know what they mean. Your one tap could reach someone tonight who has had a strange ring around their eyes for months and never connected it to their heart. That matters more than you know. And if you have not subscribed yet, please do that right now and turn on the notification bell. Every week I release videos like this one, practical, science-grounded medical information for people who deserve to understand what is happening inside their own bodies. Now, down in the comments, tell me, have you or someone you love noticed any changes around your eyes recently that you could not explain? I read every comment. Your question might become someone else's answer. Warning sign number 3, changes in the tiny blood vessels at the back of your eye. A condition your eye doctor may describe using a term called hypertensive retinopathy. I told you this one would surprise you, and the reason it surprises people is that this sign is invisible to you. You cannot see it in a mirror. You cannot see it in a photograph. The only person who can see it is an eye doctor, using a specific light during a routine dilated eye exam. And that is exactly why this sign gets missed by so many people for so many years. Remember what I told you earlier. The retina is the only place in your entire body where blood vessels can be directly observed without any invasive procedure. When your blood pressure has been elevated over an extended stretch of time, whether you knew about it or not, those retinal blood vessels respond to the pressure in very specific, visible ways. The vessel walls can thicken, the arteries can narrow. In more advanced cases, the veins can appear to be gently pinched where an artery crosses over them, a finding eye doctors call arteriovenous nicking. In the most advanced stages, small areas of bleeding or fluid leakage called cotton wool spots can appear on the retina itself. These changes have a specific and sobering meaning. A large body of research, including landmark studies that followed tens of thousands of patients over many years, has found that the presence and severity of these retinal vessel changes correlates directly with a person's risk of heart attack, stroke, and heart failure. In some studies, more reliably than a single blood pressure reading taken in a doctor's office. This makes sense when you think about it clearly. A blood pressure cuff measures pressure at a single moment. Your retinal vessels show the cumulative damage of years. There is someone I want you to meet, Patricia. Patricia was 67 years old, a retired librarian from North Carolina who had what she called borderline blood pressure for over a decade. Her readings would occasionally run a little high at doctor's visits, but never high enough in her mind to feel urgent. She managed it loosely, with the occasional reminder to cut back on salt, and life went on. She had no headaches, no dizziness, no symptoms she could point to. During a completely routine eye exam to update her reading glasses prescription, her optometrist dilated her eyes, looked at her retina, and paused far longer than usual. He told her he was seeing clear signs of arteriovenous nicking and mild vessel narrowing, findings consistent with years of elevated blood pressure affecting her small vessels, and he strongly recommended she see her primary doctor immediately for a full cardiovascular workup, not an eventual one. That workup revealed that Patricia's blood pressure, tracked properly over 2 weeks rather than a single office visit, was consistently in a dangerous range, and further testing showed early signs of left ventricular hypertrophy, a thickening of the heart's main pumping chamber that happens when the heart has been working too hard against high pressure for too long. Her optometrist, adjusting her reading glasses prescription, had caught a cardiovascular problem that a decade of borderline readings had not fully captured. What you should do with this sign is simple but critical, and it requires a shift in how you think about eye exams after 60. A comprehensive dilated eye exam is not just about your vision. Ask your eye doctor directly every single time you go, please check my retinal blood vessels for any signs related to blood pressure or cardiovascular risk, and let me know what you see. Make that request every single visit. If your eye doctor finds anything, ask for that information to be shared directly with your primary care physician or cardiologist, in writing if possible, so it does not simply stay in your eye chart. There is one more point I want to make about this sign. People over 60 often assume that if their blood pressure has been roughly fine or a little high but not concerning for years, there is nothing urgent to address. I understand that instinct, but I want to push back on it gently. Sustained borderline blood pressure over a decade is not a neutral, harmless pattern. It deserves closer investigation, and your retina may be the clearest evidence available. Patricia waited over 10 years. You do not have to. Warning sign number 4, a brief episode of vision loss or blurring in one eye that resolves completely within minutes, sometimes described by patients as a curtain coming down or the lights briefly going out, followed by vision returning to completely normal as if nothing happened at all. Now I know what you are thinking. If it went away completely and my vision is fine right now, that cannot possibly be serious. And that assumption, more than almost anything else I will tell you today, is the one that gets people over 60 into the most trouble. This condition has a name. Doctors call it amaurosis fugax, which translates roughly to fleeting darkness. And here is why it is fundamentally different from the other 3 signs we have discussed. The first 3 signs are slow, visible, physical changes that build gradually over months or years. This 4th sign is sudden, brief, and by the time you notice it, it may already be pointing to an event that has already begun happening somewhere else in your cardiovascular system. The mechanism matters here, and I want you to understand it clearly because it could matter for you or someone you love. The blood supply to your retina comes from the same arterial system that supplies blood to your brain. When a small piece of cholesterol plaque or a tiny blood clot breaks free from a narrowed or damaged artery, most commonly the carotid artery in your neck or a diseased heart valve, it can travel through the bloodstream and briefly lodge in one of the tiny arteries feeding the retina. For a short period, part of your retina is starved of blood, and vision in that eye dims, blurs, or goes completely dark. Then, often, the clot fragment moves through or dissolves, blood flow resumes, and vision returns to normal within minutes. The temptation, understandably, is enormous relief followed by dismissal. It happened, it is over, I am fine. But an episode of amaurosis fugax is not a random glitch. It is what doctors describe as a warning stroke, a signal that a piece of debris just traveled through your circulatory system on its way toward your brain, and it is one of the strongest known predictors of an imminent full stroke or heart attack. Research has consistently shown that a meaningful percentage of people who experience this warning sign go on to have a major cardiovascular event, often a stroke, within the following days, weeks, or months if the underlying cause is not identified and treated urgently. I want to introduce you to one more patient. His name was Walter. Walter was 69 years old, a retired firefighter from Oregon, a man who had spent his entire career trained to recognize emergencies in other people and act instantly. One afternoon, while reading the newspaper, the vision in his left eye went completely dark for about 90 seconds, as though someone had pulled a shade down over half his world. Then, just as suddenly, it lifted, and his vision was completely normal again. Walter, a man who had rushed into burning buildings without hesitation for 30 years, decided this particular emergency did not need immediate attention, because it had resolved on its own. He mentioned it to his wife almost casually over dinner. she did not let it go. She insisted he call his doctor that same evening, not in the morning, that evening. That decision likely saved his life. An emergency evaluation revealed severe narrowing in his right carotid artery, the very artery most closely linked to this exact type of temporary vision loss, along with underlying coronary artery disease that had never been diagnosed. Because Walter was evaluated within hours rather than days, doctors were able to intervene before a piece of that plaque caused a full, permanent stroke or heart attack. The cardiologist who treated him told him afterward that 90 seconds of darkness in your eye may have just saved your life because it forced us to look before something worse happened instead. What you should do if this happens to you or to anyone you love is not to wait and see if it happens again. Any episode of sudden vision loss or blurring in one eye, even if it fully resolves within minutes, should be treated as a medical emergency requiring same-day evaluation, not a wait-and-watch situation. Call your doctor immediately, and if you cannot reach them quickly, go to an emergency room and say these exact words. I had a sudden episode of vision loss in one eye that resolved on its own, and I need to be evaluated for a possible transient ischemic event. Do not soften that language. Do not downplay it because it went away. The fact that it resolved is not reassurance. It is often the only warning you will get before something far more serious. Now, I want to address something before we close because I know what some of you are thinking. You are thinking, I have one of these signs, or maybe two, and now I am scared. And I want to speak to that directly because I think about this a lot as someone who communicates medical information. I do not share this information to frighten you into paralysis. I share it to move you toward action. There is a profound difference between fear that freezes and information that mobilizes. The goal of this video, from the very first word to this moment, has been the second one. Here is what I need you to take away from today. If you recognized yourself in any of these four signs, yellowish patches near your eyelids, a gray or white ring forming around your iris, retinal vessel changes an eye doctor could identify, or an episode of sudden temporary vision loss, AS, the right response is not to panic. The right response is to pick up the phone tomorrow morning or today if the sign is sudden vision loss and call your doctor's office. When you call, use these specific words. I would like a full cardiovascular risk evaluation, including a lipid panel and blood pressure assessment based on a change I have noticed involving my eyes. You do not need to explain further. You do not need to justify the request. You are 60 years old or older, and having your cardiovascular risk checked is a completely appropriate and reasonable medical request. If your doctor pushes back, push back gently and firmly. Ask again. Your health is worth advocating for. If your results come back normal, wonderful. You have peace of mind and you have learned something valuable about your body. If your results show something that needs attention, you have caught it early, and early is everything with heart disease. Early is the difference between managing and medicating. Early is the difference between lifestyle changes and a hospital bed. Early is the difference that changes the entire trajectory. Susan, the retired nurse from Michigan who lived with those yellow patches for a year and a half, she caught her cholesterol condition, started treatment, and her latest lipid panel shows her LDL down to a healthy range for the first time in over a decade. She still has the patches, faded now, and she says she looks at them every morning as a reminder rather than a blemish. Gerald, the mechanic from Arizona whose wife noticed the ring around his eyes. He is now on cholesterol medication and has made changes to his diet that his cardiologist calls remarkable for someone who told me 6 months ago he'd rather work on a transmission than a salad. His coronary calcium score, rechecked recently, has not progressed further. Patricia, the librarian from North Carolina, whose optometrist caught what a decade of borderline readings missed. She is now on a proper blood pressure management plan, checks her pressure daily at home rather than occasionally at appointments, and her most recent heart ultrasound shows the early thickening has not worsened. And Walter, the firefighter from Oregon, whose 90 seconds of darkness turned out to be the most important 90 seconds of his year, he underwent treatment for his carotid narrowing and is, in his own words, still here to annoy my wife about something other than my eyesight. The eyes tell the story. You just need to know how to read it. Save this video right now, because the next time you notice something about your eyes that you cannot explain, I want you to be able to come back here and check. Show it to a family member. Show it to someone you love who is over 60, because I can almost guarantee that someone in your life is experiencing one of these 4 signs right now and has no idea what it means. Subscribe to this channel and turn on the notification bell. Next week, I'm going to release a video that I think is going to be just as important as this one. The specific morning habits that cardiologists say are silently accelerating heart disease in people over 60, habits that seem harmless, habits that most doctors never think to ask about. You will not want to miss it. And please, right now, drop a comment below. Tell me, how many of these 4 signs did you recognize? 1, 2, all 4? Type the number. I read every single comment, and your answer might help me understand what the next video needs to cover for people just like you. Your heart has been quiet for a long time, but now you know what your eyes have been trying to say.